Hi, I'm Saleha Singh, and this is Chai Chat and Community. Today, we are chatting about something that's both fascinating and a little unsettling: the role of artificial intelligence in mental health. Last week, OpenAI revealed that more than 1 million people around the world use ChatGPT each week to talk about suicidal thoughts. Here in Australia, that could mean 41,000 people turning to a chatbot when they're feeling at their lowest and are most vulnerable. It's a sobering thought that people might be reaching out to AI when they are in deep distress. On one hand, it's a sign that technology can provide a safe space to open up. But on the other, it raises tough questions about empathy, trust, and what happens when that listener isn't human, like my guest today. If you are listening to this podcast and it is triggering for you, please reach out for support. You can call Lifeline on 131 1114. I'll repeat that again: 131114, or Beyond Blue on 1300 224636. And if it's an emergency, please dial 000. In this episode, I'm speaking with Dr. Sampath Arvapalli about how AI is changing the landscape of therapy, the promise, the pitfalls, and why human connection still matters most. Sampath is a consultant psychiatrist and a medical director, leading a multidisciplinary team of clinicians across programs. Thank you so much for joining me today, Sampath. And sorry about what happened earlier. I don't know. We just didn't record. I'm just fascinated with what you had to tell me. And thank you for joining me in having this very, very important conversation. Before we start, again, do you mind telling us something about yourself?
Thank you, Saleha, for having me on this chat. So I am Sampath Arvapalli. As you mentioned, I am a psychiatrist, and I've been working in Australia for the last 7 years. But previous to that, I trained and worked in the UK for 15 years, and I've been working with the Banyans Healthcare for the last 4 years as a psychiatrist and as a medical director. So as you mentioned, the topic, the AI in mental health space, is of very much relevance to us at this stage, because I get these questions every day from my patients, from my colleagues, and from the service providers who just keep checking on what's happening in that space all the time. Yeah,
Of
because
course.
so many sweeping changes are happening at the moment in this area. Yeah.
Scary and fascinating.
Yes. Yes.
So, like we were talking, we recently heard over 1 million people worldwide are using ChatGPT each week to talk about suicidal thoughts. From your clinical perspective, what does it say about how people are seeking help today?
Yes, there's a lot of people trying to turn towards AI. Firstly, because it's very accessible. Secondly, it's very affordable. And thirdly, it's also anonymous to get these kind of helps, and it's available 24/7. So a study in Australia showed about a third of those surveyed turned to AI therapy chatbots to beat the costs and also the long queues. Okay, obviously, I'm
Whoa.
yeah. So, so I'm trying to give you a very balanced view of this because I don't want to throw the baby out of the bathwater yet. But at the
Sure.
same time, we have to be very much cautious in interpreting what's happening at the moment, given this sudden increase in the uptake of these things, and if this could actually undermine any of the actual benefits that people would have in having a direct contact with that human interaction. Because these AI-led services could be used as long as they have an oversight of a human. Yeah.
And what is the age group, Sampath, who turning to AI for help when
Yeah.
they are at the most vulnerable?
The most prominent AI therapy users are aged between 16 to 25 years. And this is a generation that's accustomed to working through relationships life issues, and communications through digital technology, they are almost at risk of dropping out tendencies as well are quite high, because um, they not stick with it for long enough, and that premature abandonment can also risk the outcome as well.
Really?
So that's why the human oversight is very important.
Yeah, yeah. So, do you think AI chatbots like ChatGPT can genuinely help someone in distress, or could they risk making things worse? Because, like you said to me earlier, ChatGPT or any AI bot or any bot, they are dependent on what they are getting from other websites. It's not really a human touch, no empathy, no connectedness, nothing.
Yes. Yeah, it's quite a complicated response for that, because I would say there are pros and cons, as I said earlier.
Yeah,
The pros are that it can be easily accessed, as I said
yeah.
earlier, but the cons are that, a lot of times um, there's a risk of overgeneralizing things. And people go through these stages of connection to the AI, which actually fosters, I mean, AI fosters dependency, and that's what leads to a lot of issues. So when people start interacting with AI, um, the first stage, what I've seen is the mirroring, where the AI starts to agree with them, give them more of the emotional responses or understanding that they would want to hear. So it kind of reinforces their thinking to a certain level. And then in the next stage, there is something called boundary dissolution. So where the AI people start addressing AI as more as a partner rather than a tool. We always should remember that it's only a tool. It can't be a true replacement for a human emotion and a human understanding. So, but here people start to look at the AI more as a partner rather than a tool. So they start to assign names to it, and start to experience grief or interaction, you know, as if they were human. And then they start to have a reality drift where they seek validation from AI rather than humans for everything they're doing in their life. So for every question they have, they need to go back and check things. So I have a lot of my patients coming back and saying at this stage, when they're in stage 2 or 3, that am I doing the right thing here? Yeah. And
So they understand, and that was what I was going to ask you,
yeah.
because this was a few months ago where I think there was a news item where it talked about how AI egged somebody, a young person, to commit suicide,
Yes.
and that's scary, isn't it?
Yes, it's really scary, and that's the skill that the AI doesn't have. The AI doesn't have the skill of um, studying the emotional responses, what we call as the mental state examination.
Yeah.
What's the body language? What's the subtlety in subtle changes in the person's um, presentation? Okay, and are they presenting as being psychotic? Are they presenting as being agitated? There is no way to study that. And sometimes even the cognitive level of that person, do they have the level of understanding to even process what the AI is putting through to them? And is what about the risk assessment? What does the AI understand of where they are, who they're living with, who they're connecting to, what their emotional support systems is out there? So, and when AI starts to pick up conversations from other places and tries to um, take that on board as reality and gives that information out to a patient, like the example you gave me, it could actually collude and leads to increasing the risk of suicidality. Yeah.
So are big tech companies taking responsibility for this, or have they just? I mean, I'm just. I mean, if I was the young person's parent, I would be so worried. But you can't hold anyone responsible.
Absolutely. And the clinical services in Australia have to go through the TGA approval. So there
Yeah.
is, because TGA approves any clinical service based on the clinical efficacy and the safety, right? So these tools, they basically bypass the governance by calling them wellness tools. But they're really not completely focusing on just the wellness. Sometimes the kind of assessments and advice they might be giving might be stepping over the limit. So I think we need to have a lot more evidence to support any use of this. And because this is early stages,
Yeah.
we have to be very careful. Yeah.
Um, I told you how I started my podcast during COVID. At that time, we talked about mental health and amongst migrant communities and also amongst international students. This is something that they faced. For many, this is the first time they've been away from home. And if you live anywhere in Asia, let's say India, Pakistan, Bangladesh, you don't have enough money to go back. You don't have family. Phone calls are just not enough. So, what I want to know is that, there is a lot of visa stress, there's isolation, there's financial pressure. What are the risks when they start relying on AI for emotional comfort instead of, um, human support? Like I know many students I was talking to, and I used to work in a university a few years ago, and
Mm.
they never have enough money, and so they are part of the gig economy. So, and they have to pay rent, they have to look after themselves, they're repaying the loan for their studies. There's no money for anything. Sometimes I know students don't have money for top ups also. So, how do they call? So,
So
what do you, yeah,
definitely, I understand how we connect to our families in India. I'm from India myself. So
as am I? Yeah,
yes. So for example, if you were to do a WhatsApp call or a FaceTime call to talking to your parents versus seeing your parents is very different, isn't it? Being there with them is
yeah,
different. So that emotional connection is very important, especially among the migrants and also the indigenous community. There's a lot of non-verbal communication that goes on.
absolutely. Body language.
Body language and connect. The space within which you are connected is different,
Yeah,
versus over the Zoom or video consults. And I think AI doesn't get that, first thing. The second thing, as you said, from the COVID times, nobody thought that telehealth would become this big.
yeah,
COVID gave an opportunity for people to start trying out the telehealth services, right? So that way, people got comfortable over doing telehealth. But then, even today, a lot of patients still want to come and see us in person because it's not the same thing seeing a psychologist or a psychiatrist over a video uh, conversation. So I think there are benefits from seeing people face to face and having
yeah.
that. Most importantly, if it's in the addiction specialty, about how they're presenting, whether they've got eating disorders, how they present, and if they self-neglect from depression, how are they presenting? If they're psychosis, how are they responding within the community, within that conversation is very important. So I think in early stages, it's okay to connect through to AI to understand where to get services, where to get help. You can use AI that way. So what are the available resources around me?
The resources, yes.
Yeah, what is a free resource? What is a low cost effective resource? Whereas group interventions versus one-to-one interventions, you can use AI to get you that information, but not directly as a chatbot that will give you the psychological or emotional support.
Yeah. And yeah, thank you. So, some people say that they find it easier to talk to a chat box because there's no judgment. And Sampath, we know you, both you and I know, we are full of judgments. All of us are constantly judging, and mental health is something that we are still not comfortable discussing. It's
Yeah.
such a big thing. So, from a psychological point of view, can that ever be a sustainable way to cope using a bot?
I think that's a very important point because judgment, and I think a lot of stigma is what affects people's ability to access treatments. And
Yeah,
mental health is, the stigma around mental health is so big. And even though we are now in developed communities, we still, as a community, like from the subcontinent, it's hard to think differently on that point of view. And I would say stigma plays a really big role. And I always encourage people to connect to people with similar cultural background, express yourself at least as the first line before you can step out and access help if you can't do that straight away. Yeah.
Yeah, we all leave our countries of birth for a better life, and we all carry our baggage with us. And
Yes.
that's where all the issues start. And I read so much of this on social media groups and pages. There are some groups I'm just there to find out what is happening amongst young people, because that gives me a reason and for my podcast. And I still see mental health is such a big thing. A lot of people just say, go to the mandir, go to the masjid, go to the church, never go to a psychologist. Thankfully, nobody has now said from there. I haven't seen anyone say, ask AI for help, because that would be really, really something difficult to understand.
And again, that's what I was saying earlier. I mean, emotionally, because AI will collude with what you want to hear. It tries to give you the responses that you're more likely to respond to, which
yes,
probably is not always good. So that's why sometimes you need to be challenged in a very appropriate way, in a timely manner, so that you know, uh, so that you're able to process any unhelpful thoughts. Those unhelpful cognitions have to be processed, and AI might not be able to do that effectively, whereas a therapist would be.
yes, absolutely. My last question
Yes.
is that if someone is listening right now and they feel tempted to turn to a chat box in a moment of crisis, what would you say to them about the importance of reaching out to a real person?
Um, I think, as I said, you could definitely use AI to look for where the nearest services are, what are the options that are more suitable to you from a financial point of view, or from a logistic point of view, cultural point of view, whether you want to do things in groups or individuals. But I can proudly say that we at Banyan's Healthcare, we work as a multidisciplinary team. So we have the advantage of checking how the person's doing medically, and then discussing that with your psychologist from a psychology point of view, and also talking to someone else and seeing how are they doing socially in their communication in the outside environment. So that the pure biopsychosocial approach could be practically better put in place when you see people in person, whereas through AI it can be a bit fragmented. Sometimes, even if you take an AI summary to a psychiatrist,
Yep.
it might not be all true, because I've had a few patients who presented me
Wow.
the AI summary of their life history, and then I had to ask them, is this correct? And they were like, "Oh, Dr. Sam, I don't know where that came from. That wasn't me." So that could lead to misinterpretation as well. So just be very careful if you're actually doing that. If you're taking any AI led summaries like of your history, life history, or whatever it is, be careful to go through that and present it to the clinicians as well.
So basically, at the heart of it all is that no technology can replace warmth of a real human conversation, whether it's a friend, a family member, or a psychiatrist like you. Reaching out can actually and truly save a life. If you or someone you know is struggling, please contact Lifeline on 131114 or Beyond Blue on 1300 224636. And if it's an emergency, always call 000. Sampath, thank you so much for joining me today. This has been a great conversation. And from whatever you said, I hope young people are listening and they go to a real human being and not seek help, especially mental health or even physical health, because Dr. Google can throw out all kinds of advice. But now we go a step further. We have ChatGPT, we have Copilot, we have Gemini, we have everything. So I hope they go to a real person. Thank you so much for joining me today.
Thank you, Saleha. My final take home message would be that AI does promise a lot for our future, from the point of improving treatment efficacy, efficiency, and the way we deliver care. Okay. But we are still in the early stages. So please check with a human oversight, whatever we do.
Thank you.